Kapit ah.
Layo para ba? Dito pa sa unhan.
Sige ma'am, salamat.
Okay.
Let us first define community, health, and nursing. Community is a collection of people who interact with one another and whose common interests or characteristics form the basis for a sense of unity or belonging. Health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. Lastly, nursing is the profession or practice of providing care for the sick and infirm. Therefore, community health nursing is the synthesis of nursing practice and public health practice applied to promoting and preserving health of the population, which means that we, community health nurses, direct our care to individuals, families, or groups, while public health nursing is the practice of promoting and protecting the health of populations using knowledge from nursing, social, and public health sciences through governmental agencies. The following are the roles of public health nurses.
Development Goals were 8 international development goals for the year 2015 that had been established following the Millennium Summit of the United Nations in 2000. The 8 goals are: eradicate extreme poverty and hunger, achieve universal primary education, promote gender equality and empower women, reduce child mortality, improve maternal health, combat HIV/AIDS, malaria, and other diseases, ensure environmental sustainability, and develop global partnership for development. The attainment of the Millennium Development Goals has led to a significant improvement in the health of the people worldwide. However, there are still a lot of improvements to be done. That is why in September 2015, the General Assembly adopted the 2030 Agenda for Sustainable Development that includes 17 Sustainable Development Goals or SDGs.
The Philippine Health Agenda 2016 to 2022 aspires to create a society in which Filipinos have the means to lead healthy and productive lives and have a health system where Filipinos feel respected, valued, and empowered in all of their interactions with the system. The 5 strategic plans include: first, ensure full access to immediate impact intervention. Second, empower people to live healthy lives and enjoy responsive health services. Third, anticipate and mitigate disasters and environmental and emerging health threats. Fourth, overcome fragmentation to achieve universal health coverage. And lastly, support health in all settings policy.
Are you hurt? Are you in pain? Or do you feel sick and want to get help? Then you should know where to go first. At this juncture, I will be discussing the level of healthcare and referral system. In primary level of care, it is devolved to the cities and municipalities. It is provided by center physician, public health nurses in barangay health station or rural health unit. Health center of different barangays are an example of primary healthcare facilities, and it should be the first place where you should go. In secondary level of care, it is given by the physician with basic health training. It includes infirmaries, municipal and district hospitals, and the outpatient department of provincial hospitals. It is the referral center of primary health facilities. It includes MMC, GMC, and General Santos Doctors Hospital. In tertiary level of care, it is rendered by specialists in health facilities including medical centers as well as regional and provincial hospitals. It is the referral center for secondary care facilities. Here in Jensen, the only level 3 facilities is St. Elizabeth Hospital.
In primary prevention, it aims to prevent disease or injury before it ever occurs. This includes immunization. In secondary prevention, It aims to reduce the impact of disease or injury that has already occurred. This includes diet and exercise to prevent further heart attacks. Lastly, in tertiary prevention, it aims to soften the impact of an ongoing illness or injury that has lasting effects. This includes stroke rehabilitation program.
Magandang umaga sa lahat. Ako pala si Elvin Tulfo at nandito ngayon tayo sa Elvin in Action. Magandang umaga po sa ating mga tagapanood. Nasa linya po ang ating mga complainant na si Miss Shane at Mr. G.
Ito na kasi Manong Elvin, may kasunduan na kaming dalawa na huwag iputok sa loob. Pero pinutok sa loob!
Ngayon naman, pakinggan natin ang mga payo na mula sa ating mga community health nurse.
So para po sa reklamo ni Miss Shane na hindi niya gustong mabuntis, may family planning program po tayo dyan para sa mga babaeng ayaw magkaroon ng mga anak. So sa family planning po na ito, ay libre po ito sa ating mga barangay. So may iba't iba po tayong methods na ginagamit sa family planning. Ito po ay ang natural methods, artificial methods, at ang permanent methods.
Ano magagawa ng mga methods na yan? Buntis na nga!
So sa kaso naman ni Ma'am Shane ay nakahanda ang WHO Philippines or World Health Organization Philippines ng mga maternal health services na naglalayong pangalagaan ang health ng ating mothers, children, and families sa Pilipinas. So ngayon, meron tayong antenatal registration wherein free prenatal services para sa mga buntis or para kay Ma'am Shane. At meron tayong tetanus toxoid immunization na kinakailangan na ma-immunize ang ating mga buntis habang sila ay buntis at pagkapangalak nila, kailangan din silang maturukan ng boosters.
Yung mga paggastusin ng bata, yung mga immunizations na yan, anong paggastos namin? Wala ka itong trabaho!
So para naman po sa immunization na sinasabi ni Miss Shane na wala kayong budget, huwag po kayong mag-alala dahil may ino-offer po na libreng pabakuna ang ating community. Ito po ang tinatawag natin na expanded program of immunization. So wala po tayong gagastusin dito kasi libre po ang pabakuna sa ating community.
Maraming salamat sa ating mga community health nurse at dyan po nagtatapos ang Elvin in Action.
Good morning, class. So we have our new activity today. Are you familiar with family case study?
Kailan po deadline yan, ma'am?
So ang deadline po natin nito is next Saturday. Okay, students, i-extend ko ang deadline for the case study. So today, I will give you time with your group. Gagawa ko ng room para makapag-meeting kayo. Is that all clear?
So guys, we are already done in home visit. The next step that we're going to do is to compare the data na nakuha namin by doing physical assessment and interview.
Una, sa family structure, characteristics, and dynamics, socioeconomic and cultural characteristics, home environment, health status of each member, and values and practices on health promotion, as well as the maintenance and illness prevention.
Gaya nung kay Vilma, so the case study of Vilma, which was our previous lesson po, that correlates with our our family. So I think that's
Yes, of course din pala, no? Katulad din nung kay Mang Ambus case study. Kasi it shows correlation to our conducted studies, although Mang Ambus naman case is slightly different when it comes to the scenario, but it still implies the same root of problem which we can prevent using the nursing intervention, di ba?
Oo, Sed. So, after nyan, kailangan pa natin i-estimate yung ating nursing need, particularly doon po sa ating family by using yung ginagamit nating coping index.
Yes, then we will analyze and diagnose the problem of the family.
Then the problems identified are categorized into presence of wellness state, health deficits, health threats, foreseeable crises, and then stress points.
Then we will prioritize the problems that has been identified according to their scores based on the criteria of nature of the problem, modifiability of the problem, preventive potential, and salience with their corresponding justification.
Yes din, no? We can do it. And then, through this study naman, we would able to analyze how a specific problem can affect the whole family. As well, how we can give solution to the existing circumstances of the family, di ba?
Tapos mag-come up pa tayo ng nursing interventions, di ba?
Oo, kaya gagawa tayo ng family nursing care plan para ma-solve natin ang mga problems ng family na napili natin.
Kayang-kaya naman pala natin to gawin, guys, no? Dahil sa mga tinuro at binigay ng mga activities ng dati ng mga CI natin.
Kaya natin. So, meron pa ba kayong queries para ma-address natin sa ating mga CI? So, kung wala na, so I think all we have to do is be persistent with our work, and I think we're done here. So, let's wrap up our meeting to start off with our work. So, thank you very much for participating, everyone.
Goodbye, guys. Thank you.
Bye-bye.
Bye-bye.
Work na.
Bye-bye.
Bag technique is a tool used by the public health nurses so that during their home visits, they can perform the nursing care with deftness and ease and can prevent wasting time and spreading of infections. Of course, I have learned in this topic how to perform the procedure of bag technique and its importance in preventing cross-infections while carrying out the nursing care during home visits.
Benedict test is a simple chemistry test which is used to detect the reducing sugars. Reducing sugars are the carbohydrates that have free aldehyde or a ketone functional group in its molecular structure. These include monosaccharides such as glucose and fructose, and disaccharides such as lactose and maltose. So the Benedict reagents, also known as Benedict solution, is used in Benedict test for detecting simple sugar such as glucose. And also, this Benedict test is used to test for a simple carbohydrate.
Heat and acetic acid test. So this is used to determine the presence of albumin in the urine. So this test is one of the most commonly used method for the detection of albumin of the urine. So what I've learned in this acetic acid test is the procedure and on how it is done and how to read the result of the test. So as albumin in the urine observed, the presence can be conclusively established by this test, so which aids in the diagnosis of diseases.
Over the past 5 months of learning, I have learned that germs or pathogens cause communicable diseases spread from one person to another. This learning helped me to be cautious since different diseases are rising today. There are modes of transmissions of the diseases which are direct contact, indirect contact, vectors, food and water, and also airborne. It is important that we have a proper knowledge of this kind of topic so that we can prevent it. They said prevention is better than cure.
We all know that communicable diseases are diseases that can be transferred from one person to another. So over the 5 months of learning, I learned that the most common type of communicable diseases present in the community is the tuberculosis. So it is very important to know information about this disease, including its mode of transmission, treatment, and diagnosis to spread awareness so that the people should know what they need to do to reduce the risk of having this disease.
So for our 10th week, we have tackled about the non-communicable diseases. So these non-communicable diseases can be hereditary or caused by unhealthy lifestyle and diet. Aside from that, we have also tackled about the National Tuberculosis Program or the NTP, which saved a lot of TB patients since it requires a meticulous monitoring of the patient and the drugs are given for free. Aside from that, after the whole treatment, the patients are monitored once again to confirm that the TB has been healed.
We learned that in making a good teaching plan is one of the vital components in rendering health teaching to our client, because it is one of the organizer tool in which it organizes the proper sequence and time allotment for the topic duration. It is a comprehensive write-up of a step-by-step teaching method that's said to be discussed for the client's health management and the maintenance of a well-being.
We all know that a brochure is a small book or magazines containing pictures and information about a product or services. We learned that an information brochure tells patients and their families about the care that is being offered and additional to the information given verbally by the healthcare professionals. It is not a substitute for verbal information but can help patients and users to take part in decisions about their health. In addition, the aim of a brochure is to have client on-hand information regarding to the health teaching that had been rendered to them. Thank you.
Newborn screening is an essential public health strategy that enables the early detection and management of several congenital disorders, which if left untreated may lead to mental retardation and or death. It is also an integral part of routine newborn care such as vitamin K injection, cord care, type prophylaxis, BCG, and Hep B vaccine.
For the past 5 months of learning, I learned that newborn screening tests are an important part of any new parent's life, and it is very important that they should be performed correctly. The goal of the screening process is to identify metabolic or genetic disorders in newborns, so that they can be referred for appropriate follow-up care. So the benefit of newborn screening is the early detection and treatment of metabolic disorders that causes poor developmental outcomes or even death, without which affected children will not have a fair opportunity for normal growth and development.
Pasok!
Good morning, ma'am.
Good morning po. Hi, ma'am. Ano pong sadya natin?
Konsulta po.
Opo, konsulta. Ano po pangalan ni baby?
Emily po.
Ilang taon na po siya?
2 years old po.
Kinukumbulsion po siya, ma'am?
Hindi naman po. About yung consciousness niya, check po natin po.
Yung ano niya po, gano'n sa pagkain?
Ay, malusog naman po, magana pong kumain.
Nagsusukal ba siya, ma'am?
Hindi naman po.
Nag-uubo lang siya.
So, ilang po, 3 days po.
3 days. Check ko lang, ma'am, ha?
Okay po.
Very good. Okay. Talikod lang ako, baby. Tingnan mo malalim, ha? Okay, wala naman pong kakaiba sa lungs niyo, ma'am, no? So, nagkaka-diarrhea ba siya, ma'am?
Hindi naman po. Wala pong diarrhea.
Check ko lang din yung temperature, ma'am. Insert lang sa aliha. Iipit lang po. And check ko lang din yung ears niyo. Okay, good. So, bukod sa, ano, ma'am? Normal lang din naman yung temperature niya, 36.8.
So, yun lang po yung typical food niya, ma'am, na breastfeeding and solid food. So, yung immunization status niya pa po, ma'am?
Updated naman po.
So, complete na po.
Opo.
So, ito lang po yung mga yung i-reseta ng doktor. Ito po yung gamot na iinumin sa loob ng 5 araw.
Okay
And
po.
then, kung hindi po siya makakainom ng gamot, may calamansi juice naman po tayo, yung pwede natin ipainom sa bata. And then, ma'am, kung hindi umi-improve yung kalusugan niya, balik lang po ka dito sa center natin sa 5 days.
Okay po.
Salamat po. Pagaling ka.
Nagbabagang balita. Ayon sa DOH, may 10 halamang gamot na aprobadong alternatibong gamot sa mga sakit. Ibalita mo, Miss Corpus.
Maraming salamat, Mr. Sanchez. Ngayon, narito ako sa opisina ng DOH, Secretary na si Dr. Helia, upang alamin kung ano-ano ang mga 10 halamang gamot na ito. Dr. Helia, ano-ano po ba ang mga halamang gamot na aprobado na ng DOH at anong klaseng sakit ang kayang gamutin ng mga ito?
Ang 10 halamang gamot na aprobado na ng Department of Health sa Artikulong 8423 of 1997 ay ang kakapulko para sa fungal infections, laxative at mouthwash, ang palaya para sa ubo, lagnat, may bulate at may mataas na blood sugar level, bawang para sa may masakit ng ngipin, infeksyon at may alta presyon, bayabas para sa paglilinis ng sugat at pwede rin gamitin sa may masakit ng ngipin, lagonde pwedeng gamitin sa may ubo, may lagnat at may skin disease, niyog-niyogan para sa pasyenteng may maraming bulate, sambong para sa ubo at lagnat, tiyanggubat para sa pagtatae, may masakit na tiyan at pwede rin gamitin pang mumog. Pangsyam ay ang yerba buena. Ginagamit ito para sa may masakit na ulo, pwede rin gamitin sa may arthritis at may masakit na ngipin. At ang panghuli ay olasimang bato, ginagamit upang mapababa ang uric acid at ginagamit rin ito para sa may mga arthritis at rheuma.
Maraming salamat po sa iyong napaka-informatibong pahayag, Dr. Helia.
Walang anuman, Miss Corpus.
At ako, si Micah Corpus, nag-uulat. Back to you, Mr. Sanchez.
Okay, so upon looking at your case presentations, I will see if you really understood your case study. So, what do you think is the importance of assessing a family and how does it affect each member's health and wellness? Mr. Tanong?
Yes po, ma'am. Well, for me po, ma'am, firstly is, of course, to provide nursing care to the family, to help them improve their ways of living, their health status, to become self-reliant and maintain their health.
Do you want to add up, Mr. Sawabe?
For me, ma'am, with this, it is very important because that families in the community will be aware of the things and practices pertaining especially to their health.
So, good job, everyone. Your study is approved and keep up the good work, student nurses.
Therefore, family case presentation or study helps to provide nursing care to the family, which can help them to improve their way of living as well as to promote the family's well-being and to help them improve their health and environment as well as teach them or educate them to become more self-reliant in maintaining their health.
We thank all our clinical instructors for their professional guidance, for their thoroughness, dedication, and above all, for their care and support all throughout. Thank you very much. You are appreciated, respected, and valued.